friends, we in previous lecture we discussed about the sources of crude drugs, and we also discussed the definition of drug, a crude drug, herbal medicine or a traditional medicine, what are herbs, herbal preparations. So in this lecture we will discuss how those crude drugs are classified. Now friends, classification means to categorize or to divide things with similar characters, properties or uses into different groups. Now if you have so many things, if you go to a chemist shop basically and you ask for a particular drug, the vendor or the chemist immediately goes to a particular corner of his shop and bring out the required drug. So how he basically knows that that drug is lying in that corner of his shop? He has already categorized or categorized those drugs into on the basis of different properties. Either he has categorized those drugs on the basis of the manufacturer, or he has categorized drugs on the basis of their uses. So he immediately knows that I have to go to that corner of the shop and bring out that drug. So this is basically he has classified various drugs that is present in his shop. Now when we talk about the classification of crude drugs, the system is a bit complex because there are approximately 5 lakh species of higher plants, and that are divided or classified into more than 16,000 genera on the basis of their morphological characters or other similar possible characters which can be utilized for their classification. Now why classification is done? Now largely the classification is done for convenience. Say for example, you enter into a library which is having around 1 lakh books, and you want to have a particular book. Suppose if the arrangement of books are random, it's very difficult to identify or to procure the required book. That is why classification is done everywhere wherever possible, and the books are arranged either in the form of alphabetic origin or on the basis of their subject, so that one can easily go to a particular area of the library where such books are kept and can identify his required book. Classification is also done for a systematic study. Suppose if you want to study a particular crude drug, and you want to have knowledge on that particular drug from the literature, and if all those drugs are arranged randomly in the literature or in a textbook, then it's become very difficult to locate that particular drug to get the knowledge. So classification also makes the location of a particular drug, and also helps in easing out the systematic study of that particular drug. It also helps in understanding the relationship between the crude drugs, if any relationship is present. So if the drugs are classified on the basis of their morphological character, then one can easily assess that the drugs that are being grouped in a particular under a particular classification system, they might also have certain basic characters that are similar among all the members of that group. So this also helps in understanding the relationship between different drugs. Now the classification, what are the characters of a classification system, or what are the ideal requirements for a classification system? So a classification system should be simple. You can easily classify the drugs, and it's very user friendly for every person who wants to classify crude drugs, and prime requirement for technical knowledge should not be there in that particular system, and it should be easy to use, so that any layman can also use that classification system to get knowledge about drugs. Then the classification system should also be free from ambiguities, so there should not be any confusion regarding the placement of the crude drug under particular category, and a system should provide sufficient preliminary information of the drug. Say for example, if the drugs are being classified on the basis of their chemical constituent, then one immediately gets an information that if a drug is being categorized under alkaloidal drugs, then one come to know about that a particular drug will have alkaloid as the major constituent. So the system should also provide a preliminary information about the drug. Now the crude drugs can be classified on the basis of the cellular organization, alphabetically, morphologically, chemically, pharmacologically, taxonomically, chemotaxonomically, and serotaxonomically. So when we talk about on the basis of cellular organization, crude drugs are largely categorized into organized and unorganized drugs. Now, organized drugs are the drugs that have a specific cellular organization, means they have a cellular arrangement or anatomical feature. Since most of these organized drugs are obtained from plants, they have specific cellular structures, and since they have cellular structures, microscopy or microscopical studies become an important aspect of organized drugs. There are certain plant drugs that do not have a cellular structure, such as gums or latex or any kind of secretions from the plant. Such drugs do not fall under the organized drug category. Now, these drugs can be used as such, or in the powdered form, or by their slight modification in the form of extracts or teas, or by extracting the biological active compound from them. Now, unorganized drugs, these are the drugs that do not have any cellular structures or anatomical features. So, these kinds of drugs, they do not have any kind of cellular arrangement, and these include basically the secretions or the exudates from the plants, like gums, resins, mucilages, even oils, or minerals or juices or latex, and so on and so forth. So, all these, since they do not have any organized cellular structures in them, they fall under the category of unorganized drugs. And since they do not have any kind of cellular structures, microscopical studies are not so important for such drugs, and as they are for the organized drugs. Now, these crude drugs can also be categorized or classified on the basis of alphabetical classifications, and in under such system, the crude drugs are arranged alphabetically on the basis of the alphabets that are used in their Latin or English or common or vernacular name, and this is the simplest way of classifying crude drugs. And one of the similar examples of such classification is the use of dictionary. If you want to locate any word, then we straightway go to the initial alphabet of that word, and then we find our word. So similarly, the crude drugs are arranged in alphabetical manner on the basis of the alphabet of their name, first alphabet of their name. And this is the most common type of classification system that is largely used by various official documents known as pharmacopoeias, like Indian Pharmacopoeia, Indian Herbal Pharmacopoeia, British or British Herbal Pharmacopoeia, United States Pharmacopoeia, European Pharmacopoeia, and so on. As already told, that dictionary and reference books use this kind of classification system. Now, this is an example of alphabetical classification of drugs, and here we can see that drugs are arranged on the basis of the first alphabet of their name: acacia, agar, belladonna, bentonite, benzoin, cinchona, colchicum, dhatura. So we can see that all the drugs are arranged on the first alphabet of their name, and that name can be either common name, common English name, or the common name known in the local language. Now, there are various advantages of this classification system, and the first advantage is it is quite easy to use, and we know that to find a word in a dictionary is quite simple. Same is here in the alphabetical classification, and if you want to locate a particular drug, you just have to go to the area where the first alphabet words are enlisted in that particular document, and you can find your drug. Location, addition, deletion of any entry is very easy, and since the location of a drug is very easy under such system, similarly the addition or deletion of a particular entry of a drug is very easy. And it also avoids the repetition of drugs, since the belladonna is basically, if we look into the example which we discussed earlier, bentonite comes after belladonna, and since it begins with B, bentonite cannot enter either after echinacea or ephedra or after phenyl, because B always come after A. So the repetition of drug is avoided in this particular classification system. Since this besides advantages, this system also has certain disadvantages, and these are it does not give you any relationship between the previous or the successive drugs. So if we go back into the example of the classification of the drugs, if we look at that colchicum is the drug, it is the previous drug of colchicum was Syncona and the succeeding drug is Dhatura. So there is no relation between the previous and the successive drug, because Dhatura is largely has effects on CNS, Syncona has anti-malarial activity, whereas colchicum is largely used for gout. Though these drugs have alkaloidal constituent, but they do not have any either morphological relation or they have any pharmacological relation. So this system also do not provide any information about chemical constituent of a particular drug, since the drugs are arranged on the basis of the first alphabet of their name. So they do not provide what type of chemical constituent or what kind of pharmacological active a particular drug is having. So these are the basic disadvantages of this classification system. So the next system is the morphological classification, and under this system, crude drugs that are obtained from plant, animal or mineral sources, they are arranged on the basis of morphology and or the plant part or the part of the plant that is being used as a drug, and on those basis these crude drugs are classified. They can be broadly categorized into organized and unorganized drug, and as we have discussed that organized drugs are the drugs that have peculiar cellular characteristics, and the unorganized drugs are the drugs which do not have any cellular characteristics. So under under organized drugs we have the drugs that are obtained from different parts of the plant. Say for example, drugs that are obtained from roots and rhizomes, and examples are ginger, that is adrak, ginseng, diascorea, ashwagandha, ipecac, licorice, which is also known as mulatti, then podophyllum, rauwolfia, rhubarb, turmeric, commonly known as haldi, and valerian. All these are the drugs that are obtained from the roots or the rhizome parts of the plant. Similarly, garlic and squill, they are obtained from the bulbs of the plant. Colchicum is obtained from the corms. Ephedra is obtained from the stems of the plant. Similarly, there are plants whose wood is used as a drug, for example sandalwood or quassia, and there are plants whose barks are normally used for medicinal purpose. Examples are ashoka, cascora, syncona, and kurchi. There are plants whose leaves are also used as drugs. We have already discussed the examples of leafy drugs, and common examples are belladonna, cannabis, dhatura, digitalis, mentha, senna, and vasaka. And certain plants whose flowers are normally used, such as clove, saffron, chamomile. Then certain fruits of the plants are also used. Examples fruits of amla, baheda, harad, caraway, cumin, coriander, fennel. All these drugs are obtained as the fruit part of the plant and are used for their medicinal properties. Similarly, this also shows the other parts like seeds and hairs, trichomes or fibers. This is an important part. There are certain hair-like structures on the plants, either on leaves or on flowers, that are also used for medicinal purpose. And for example, cotton is there. Cotton is obtained from the hairs or the trichomes that are present on the seed of the cotton. Similarly, jute is there, hemp is there. Jute is obtained as the phloem fibers of the jute plant. Hemp is obtained from the pericyclic fibers, and these are used as agents for preparing filtering media or for preparing packaging material. Silk is we know that it's a fiber of animal origin. Silk and wool are the fibers of animal origin. Wool is basically the hair of the sheep, and silk is the saliva that is surrounded around the cocoon, and it is obtained after killing the cocoon. And there are certain plants that are used as such. Whole means all the parts of the plant are used, and the common examples for the whole plant that are used as drugs are cannabis, dhatura, ocimum, vinca, and ashwagandha. Now the unorganized drugs, as we discussed, they do not have any cellular structure, but these are obtained from plants, and they are obtained as juices, oils, or exudates, or gums. And the common examples for gums are acacia, guar gum, sterculia or tragacanth gum, various volatile oils that are obtained from the fruits of coriander, cinnamon, dill, eucalyptus and so on. Similarly, fixed oil that are obtained from almond arachis, that is commonly known as mufli, almond is badam, castor is arandi, and coconut, cod liver oil and shark liver oil, and cod liver and shark liver oil are basically of animal origin. And similarly, there are fats and waxes that are obtained from animals as well as plants, and examples are beeswax obtained from bees, and carnauba, theobroma, kokum butter and wool fat. The other examples of unorganized drugs are resins and balsams, examples asafoetida, benzoin, cannabis. There are juices, aloe and quinua juice. Certain extracts of plants are also used as drugs, and common examples are black and pale catechu, and agar is an example of a drug that is obtained from marine sources. And then latex, common examples are opium and papain. Papain is a crude extract or the latex from papaya plant, and it is largely used as a source of papain enzyme. And other animal products that do not have any cellular structures are honey, musk and cantharides. Mineral like shilajit and bentonite, talc and kaolin also come under the unorganized drug categories. Now, there are various advantages and disadvantages for the morphological classification system, and the number one is it's quite easy to use. You can easily categorize the drug whether from under a particular part from which it is obtained. You can, if you are having a leafy drug, you can easily categorize that particular drug under leafy drugs. If you are using a bark drug, then you can easily categorize that drug under the bark drug category. So it's quite easy to use. And second advantage is it's convenient to classify the drugs. We have already discussed that if you are using a bark drug, you can easily categorize that particular drug under bark sections, and it also helps in checking the adulteration and identifying the adulterants. Now, when you have categorized a drug on the basis of the plant part that is being used, you can easily identify the adulterants. So if we take an example, senna is one example for which leaves are normally, or leaflets of the senna are largely used for medicinal purpose, and the stalks or the stem part of the senna plant is largely used as an adulterant for senna leaflets in order to increase the bulk and to earn more profit. So according to British Pharmacopoeia or the other official documents, not more than 3% of those stem parts are allowed in the senna material, leaflet material. So if there are more stem parts, one can easily identify those stem parts, and that helps in identifying those stem parts as an adulterant. There are different disadvantages of this system also, that it does not provide any correlation with the chemical constituent or the pharmacological activity of a particular drug. Now, since the drugs are being categorized on the basis of the plant part that is being used as a drug, so it does not provide any information about the presence of chemical constituents or the pharmacological activity that drug possesses. And the second major disadvantage of the system is that the number of drugs and plants are repeated under different categories. Say, for example, there is a drug cannabis for cannabis, leaves are also used, and cannabis as such whole plant is also used. So this drug is basically repeated under leaves as well as whole herb category. Similarly, Vinca rosea, whose roots are also used for medicinal purpose or drug purpose, and as such whole herb is also used, means leaves or flowers or a stem and roots are also used. So Vinca is also found under both the categories. Another example for such problem is ashwagandha, and in ashwagandha normally roots are used for medicinal purpose, but the other parts of ashwagandha are equally important and equally effective. Say leaves or stems or flowers of ashwagandha are also effective. So ashwagandha is also found under both the categories, either of the roots as well as for the whole herb. So this is the major disadvantage, that the plants are repeated, and it sometimes create confusion amongst the user of this classification system. So the next classification system is on the basis of the type of chemical constituent the drug is having, and irrespective of alphabetic, morphological, taxonomical and pharmacological properties, the drugs are grouped on the basis of their chemical constituents present in them. So previously we have discussed the classification systems in which the drugs were classified either on the alphabet of their name or the plant part that has been used, or their morphological appearance or pharmacological properties. This system basically requires the use of chemical constituents that are present in the particular plant, and on the basis of the type of chemical constituent present in the plants, the plants are classified in the group of the plants having alkaloid as their active constituent, and under alkaloids there are different types of alkaloids such as tropane alkaloids, and the examples of tropane alkaloid containing plants are Dhatura, Hyoscyamus and Belladonna. Similarly, another class is quinoline alkaloid, for which the drugs containing quinoline alkaloid example is Cinchona, and there are other types of alkaloids like indole alkaloids, and the drugs containing indole alkaloids are Vinca, Rauwolfia, Nux vomica. And apart from alkaloids, there are drugs which are having other constituents like flavonoids, and the drugs which are categorized as a drug having flavonoidal constituents are ginkgo biloba is a common example. Similarly, passiflora is another common example of a drug having flavonoid constituents, and we can classify the drugs on the basis of other constituents like terpenes, steroids, saponins, lipids, carbohydrates and tannins, and you can see there are different examples of the drugs under different class of chemical constituents. Now, the advantages of this system are it helps in the phytochemical studies. So, by studying this system, we can easily get an idea what type of chemical constituent are present in a particular plant, and this information helps in designing our phytochemical studies for that particular plant. It also gives, as we have already discussed, that it gives an idea about the type of chemical constituent that is present in a particular drug. But it also has certain disadvantages, that is, it creates confusion, as crude drugs contain different types of chemical constituent, and therefore same drug is placed under different classes. So as we know that plants are having different type, a single plant has different types of chemical constituent, so sometimes it becomes very difficult to classify or to put a particular drug having different types of chemical constituent, and it becomes difficult to put that particular drug under a particular category. And it does not give any indication about the pharmacological activity of drug. Since it provides you only the information about the type of chemical constituent present in a drug, it gives you no indication about the pharmacological activity of that particular drug. So next is the pharmacological classification, and in this type of classification, crude drugs are normally classified according to their pharmacological activity or their action or their therapeutic use. And in this type of classification, drugs are normally grouped together irrespective of their plant part used, or their type of chemical constituent present, or their morphological structure or character. And in this system of classification, we can categorize drugs into depending upon their activity. Say for example, there are drugs having anti-cancer activity, and the examples are Vinca, Podophyllum and Taxus. There are drugs that act on cardiovascular system, and when we talk about the drugs acting on cardiovascular system, they can be further categorized into their specific actions. For example, certain drugs, they have a positive effect on the cardiac muscles, which are known as cardiotonics, and digitalis, quill and strophanthus are examples of cardiotonic. Certain drugs help in reducing the blood pressure. They are categorized as antihypertensives, and the examples are Rauwolfia and Cinchona. And similarly, there are the drugs that can act on central nervous system, and again, when they act on central nervous system, they can have different actions, and since they have different action, they can further categorized depending upon their activity. So the drugs like opium and hyoscyamus, they are categorized under CNS depressants, and tea and coffee, they are categorized under CNS stimulant. Brahmi, Shankpushpi, Jyotishmati, they are categorized as memory enhancing drugs, and tranquilizers, the example is Rauwolfia. Similarly, the drugs acting on other parts of the body, that is gastrointestinal tract or respiratory system, or they have certain effect on their immune system. They can be categorized as per their pharmacological effect or the therapeutic activity for which they are largely used. Now, the advantages and disadvantages of the system. Basically, this pharmacological system helps in identifying a substitute on the basis of the pharmacological activity. Now, since the drugs are basically categorized on the basis of their pharmacological activities, and if a particular drug is having a supply shortage, so its substitute or another drug with similar pharmacological activity can also be used. So if we go back to the table of examples, we can see that for anti-inflammatory drugs, colchicum, turmeric and guggul are listed. Since guggul always has certain supply issues, and if somebody is using guggul for inflammation, he can substitute guggul for turmeric also, because haldi is also known for its anti-inflammatory properties. But this substitution cannot be considered as the replacement of the drug. This is only the temporary substitution of a particular drug. Now, this system also has certain disadvantages, like it does not give information regarding the chemical constituent, as the drugs are basically categorized or grouped on the basis of their pharmacological activity. They do not provide any information regarding the chemical constituents. And most of the drugs have multiple actions. Since the drugs have different types of chemical constituents present in them, they basically have different actions or different pharmacological or therapeutic actions due to those different chemicals. And when they have different or multiple actions, the same drug may be placed under different category. And when a same drug is placed under different category, it sometimes create confusion in the mind of the user. Say if we look for an example, opium is basically also used as a CNS depressant, but opium can also be used as a central analgesic. Now, both the properties are different. Basically, it causes depressive action and central nervous system, and opium also acts on opioid receptor in the brain, and hence thereby increasing the threshold of the pain and act as an analgesic. Similarly, Cinchona is largely used as an anti-malarial drug, but it has certain constituent that show anti-hypertensive action or cardiac depressant action also. So sometimes it becomes very difficult for the user to get the correct information that where exactly a particular drug should be placed. But largely in this system, the drugs are placed under the categories that are the major use of that particular drug. So if we simplify this by an example, I will again take the example of Cinchona. Since Cinchona is largely used as an anti-malarial agent, so it should be normally placed under anti-malarial category. But since its alkaloids, cinchonidine or quinidine, have anti-hypertensive or anti-arrhythmic action, it is also being placed under those categories. So friends, till now we discussed around alphabetical, morphological, chemical and pharmacological classifications of crude drugs, what were their advantages and disadvantages. So in the next lecture we will be discussing about the taxonomical, chemotaxonomical and serotaxonomical classification of the crude drugs, what are their advantages and disadvantages. And besides the classification system, we will also discuss about the adulteration of the crude drugs, what are the various methods of adulteration and why basically adulteration is done and what should be done to stop such an adulteration. Thank you.